Afternoon, Lynnie. How are you?
Doing great.
Thanks for making some time for me and the class to be able to see and meet you. And so, first, let's keep it really basic to begin with. Give me your name, your title, how long you been here, kind of what's your real role here?
Okay. Well, my name is Lynnie Meyer. I'm the Senior Vice President and Chief Development Officer at Norton Healthcare. I've been in my role 18 and a half years. I'm a nurse by training. I started my career at Norton Children's and I worked in healthcare for 13 years, and then I led the Center for Women and Families, which is a nonprofit, as you know. That's where we had the opportunity to meet. And I was at the center for almost 8 years and transitioned from there to the role that I'm in today.
Just for complete transparency, Lynnie and I have known each other for, I don't know, 25 years. And I've worked for Lynnie 3 times, actually, technically, twice at the Center for Women and Families and once at Norton Healthcare. I spent 5 years under Lynnie's leadership. And so tell me about what you do at Norton. I know a lot about Norton, and I assume that some of the people in the class know, but really, what is it that your leadership provides? What's the foundation do? How does it impact Norton Healthcare?
Okay. Well, as you know, Norton Healthcare is a very large healthcare system. We are a not-for-profit. We have 5 adult hospitals and a new hospital being planned at 28th and Broadway in West Louisville, as well as Norton Children's Hospital, which is the only freestanding children's hospital in the state of Kentucky. Children's is a level 1 trauma center. When I started in 2004, my role was exclusive to the Children's Hospital, primarily around fundraising through the Norton Children's Hospital Foundation. And I lead a community board of about 30 people who work as volunteers and ambassadors on behalf of the mission and work every day, day in and day out, to raise dollars from the community to support the mission at Norton Children's. The adult hospitals are also supported by our adult foundation, the Norton Healthcare Foundation, and I came into responsibility for that role in 2006. So it's really just been a journey of increasing responsibility. And this year, the 2 foundations will probably raise $40 million to support the mission of Norton. And we have about $160 million in assets on our balance sheet, where we do grant making from restricted funds, where a donor has made a gift with the intention of supporting our oncology programs or our prevention and wellness agenda. And we hold those dollars for strategic grant making.
That's amazing. So you think that you're going to do about 40 million. So when you came in 2006? 2004, how much was Norton raising?
I think it was combined around 1.8 million.
1.8 million a year, and you're going to do 40 million.
Right.
What fascinated me that you taught me early was the fact that hospital systems, health systems, especially big ones, the bottom line that they can reinvest back into their entire operations is very small margins. Do you know what that is about?
Yeah, so it's very interesting. You think about healthcare as being big business, but as I mentioned, we are a not-for-profit system, and we're investing back in through financial assistance for families or any type of financial assistance to provide support to the community so they can access health care. You think about the strongest health systems across the country. You think of the big names, that we all read about. The very strongest health systems in the country have about a 5 to 6% operating margin.
Okay.
So if you build $1, you would get back a nickel. Okay, that's the best analogy that I have.
Yeah.
At Norton, I would say that we run about a 3 to 4% margin, which is healthy. But if you're billing $1, you're only getting back 3 cents.
Yeah.
So think about that in the context of aging infrastructure, workforce needs, innovation, technology, electronic medical record. It is nearly impossible to invest in growth or innovation on a 3% margin.
Yeah.
When you have aging infrastructure, 100-year-old infrastructure in some locations that you're trying to develop and advance and support, changing workforce, training and development, technology, So really, many of the programs that we have just simply wouldn't exist without philanthropic support.
So I know this used to be the case. I'm assuming it's somewhat the case now. Is that your cost per dollar raised, which is kind of the same as a margin. It was somewhere in the neighborhood of 15 cents on the dollar or something like that. Is it still about that?
Well, the children's side runs a little lower.
Okay.
Just by virtue of who it is as an academic facility. We are the teaching hospital for the Department of Pediatrics at the University of Louisville, and teaching hospitals tend to outraise community hospitals. An acceptable cost to raise a dollar across the country would be 30 cents for a community hospital system. Both of our foundations this year are just hovering around 5 cents, which is unusual. We budget about 20 cents to raise a dollar, but we're running much lower than that. We've had some very large gifts this year that have offset the cost to raise a dollar.
So to put that in context, compared to what you were talking about with the kind of the amount that you're able to reinvest back in off of the dollar raised, a dollar not raised, the dollar earned, for the services. Those are, let's say, 3 to 4 cents, and over here on your philanthropy, you're doing somewhere in the neighborhood of 90 to 95 cents.
Well, it could even be a dollar for dollar if a donor makes a restricted gift.
Okay.
Which most donors today tend to want to restrict their gifts. They want to know exactly where their dollars are going. And I think you see that as a shift in giving across the nation to all sectors.
Okay.
In the old days, people would give through payroll deduction, or they might give to a large community campaign, a community trust, or some type of community organization that then would grant make. So younger donors want to be involved. Yeah. They want to volunteer where they're giving their money. They want to have a voice in where their dollars go. So we're seeing an increasing shift towards restricted. If a donor restricts their dollar for a program or a service, dollar for dollar, 100%, we do not take an overhead allocation out of that.
Wow. But
so
even
all of
on
that goes to the program.
But thinking about that 40 million, and I'm just going to use round numbers and say that, it was 10 cents that it cost you,
right,
just because I'm not good at math. So 36 million you've been able to, that you'll likely invest back into programs and workforce, which I'm sure is another item that's high on the list today. But you're able to take 36 million, which if you flip that and said, okay, at a 3 cent margin, how many hundreds of millions of dollars would it would have taken almost $1 billion to make that same amount.
No doubt.
Revenue.
If you tried to build to get 40 million to drop to the bottom line on a 3% margin, that'd be in the billions.
How does that impact, I've been around the community and obviously around you and around Norton for a long time. And, I remember when I first came here, shortly after you did, Norton was obviously a growing entity, but wasn't the, I would say market leader that it is today. And I've seen programs like the Cancer Institute, not to mention obviously the Children's Hospital, but the Cancer Institute and the Neuro Institute and the Spine Institute, and all of those areas grow. How has philanthropy played a role in helping Norton be able to, develop those programs, but more importantly, also get the talent in so that there's the high level of expertise?
I think 3 areas really. One is innovation. So just for example, we funded a laser, a brain tumor neuroblade system. And when the Neuroscience Institute brought that forward, we only had 6 patients that would qualify to use that particular equipment in that year.
Okay.
Those 6 families had left our market and gone to another state.
Yeah.
And the foundation board immediately said yes, that it was worth it to us to invest in this equipment so that those 6 families could stay in our market. That is now a standard of care, and the volume has grown exponentially.
Okay.
So 1 is innovation.
Right.
2 are things that create a differentiator for us. We've funded 12 meditation gardens.
Oh, wow.
We have 35 food pantries. We have meditation gardens, food pantries, things like that you wouldn't have if you built a building, right? That you might build a building, but it wouldn't have a resource center. It would not have the the support functions that we're able to bring through philanthropy.
Mm-hmm.
And I think that our gardens and our meditation rooms and our resource centers are differentiators for us. I think that pet therapy is a huge differentiator. We have 12 therapy dogs, one of the largest therapy programs in the country. And those dogs all have handlers. They're full-time employees, 100% funded by the foundation. But they make a big difference in patient and staff satisfaction, and they are a big differentiator. So innovation is one, being a differentiator in programming is two, and the third, as you mentioned, is workforce. Being able to start a position, to endow a chair, to create a fellowship, to hire a social worker, an educator, a doula, a community health worker, to start a program that would be something new and help a program get its legs, maybe support it for 2 to 4 years, and then it's able to kind of run on its own.
Well, and I know on a workforce standpoint, especially those endowed chairs, to get the best, sometimes you have to have that kind of panache around a position, and that stable funding for somebody to come here.
Absolutely true. I think when a young professional looks out across the country, they don't always think of Kentucky as the first place to come. And we've done a lot of endowed chairs with the university where they hold part of the money and we hold part of the money, and we come together to create that academic chair. People that are starting their careers, they want to be engaged, they want to be involved with scholarship, with research, with publishing. And so if you can give them the clinical work with a little bit of protected time, that creates the best of both worlds for them.
Well, the focus of this class is around strategy and healthcare strategy specifically. Talk to me a little bit about strategy as it relates to how, you think about strategy, both from a philanthropy standpoint, but also how does philanthropy play into the overall strategy of Norton Healthcare?
Well, every single service line, obviously we have hospitals, right? But we're set up into key service lines. Mm-hmm. Norton Cancer Institute, Neuroscience Institute, sports health, orthopedics, women's services, and each of our service lines has strategies around workforce, around facility, around programming. They've woven philanthropy into that.
Okay.
So we'll talk about those nice to haves, those things that are differentiators, those things that we could do to grow. And philanthropy now is at the table, right, as part of the team, that you have the clinical leadership team, but we're there just with our marketing partners and our HR partners. We're there supporting the system, but we have a line woven through all of our service lines where we know we have a case for support, where we have the opportunity to bring people in.
So it almost feels, I think from an outsider, one of the things that I've always heard about philanthropy is that it's almost a chicken and egg situation where is it the donor that's driving the objective? Is it the organization driving the objective? But what I kind of hear you saying is that it's a mix.
Well, obviously we want to meet the needs of the organization, right? And we don't want to take dollars that are not in alignment with our vision and our mission. Yeah. But you also have to honor donor intention, and you have to be able to bring donors to where they want to be. And I think we have such a compelling case for support that I could pretty much meet anyone and bring them where they want to be based on what they tell me. Mm-hmm. So it might be that they want to solve infant mortality. And I could go all the way back to prenatal outreach, and I could talk about educators at the community level, or I could talk about innovation in technology, or maternal fetal delivery centers, or I might talk about developmental care in our NICU, or the design of that NICU. So you could do a capital gift, an equipment gift, a workforce gift, or a research gift, when really your end game is solving infant mortality.
Right, that's the outcome.
And so I think if we say we want to solve heart disease, cancer, infant mortality, obesity, hunger, what is it that we want to solve? And then we can overlay, how can we get there? And I usually try to talk about that in 3 buckets, all 3 important: research, capital and facilities, and workforce. And some people will say, well, you can't take a building to lunch, so they don't want to put their name on a building. They'd rather get to know a person or get to know the program. So we really just try to align donor interest and donor intention with mission and vision.
So this is going to be a little dated when they watch this video, but last week you had a huge announcement, front page of the paper, a $15 million charitable gift in the diabetes area from the Novak family. Tell me a little bit about how does those type of opportunities come about, and how do you get something like $15 million to really look at a donor to say, I'm going to invest that much of me, because it's beyond just cash at that point.
Well, number one, I think they obviously have a personal interest, right? They have a story, they've been impacted personally. Wendy has been an advocate and has really lived her entire life talking about how people can go out and live a great life with diabetes like she has. They met a physician champion who they respected, who they've come to know and love and admire.
Here
yeah.
in Louisville. I mean,
Right.
knowing that the Novaks, if
Right.
you don't know, are wealthy, and David Novak was the CEO of Young Brands, so he could have went anywhere.
Right.
You
So
know.
they lived here, right?
Yeah.
This is their hometown. They had challenges when they moved to Louisville in terms of finding a provider that they could get into. They met a local physician who was on our Norton Children's team, and he became the champion for the program. And in 2013, they made their first investment that was $5 million. It's been 9 years of developing the relationship and growing the service, growing from 3 providers to 60, going from
Wow.
unknown, unranked, unnamed to now number 16th in the country. And they're fully invested. And them saying, we understand there's still gaps. We have children that have done well, that have grown up, that need transition and care support, and we have adults that are still being unserved. So that was really the rationale behind the Institute and the creation of the Wendy Novak Institute, to build a bridge from children's services to adult services.
Okay.
And to keep building on this journey towards greatness, right? Going from 60 providers to hopefully what will be 80, 90, or 100, and going from number 16th to 10th to 8th to 6th, ultimately, which our CEO likes to say, this is not a goal, this is an imperative, that we will be the number 1 ranked program in the country.
So talk to a minute about, so when you say that, CEO Russ Cox, saying that, how important is it to have leadership support when you're dealing with developing a program like that? That's, it's not an overnight success. It wasn't a gift just out of the blue. It was obviously something that took a lot of effort, and more than anything else, it took every day delivering on the promise.
Right.
It didn't just take, hey, I've got this grand vision, but after years and years of showing that I can execute on it, that they can see something even bigger. How important is it to have like CEO, C-suite level, kind of support around that?
I think that transformational and inspirational gifts do not happen without leadership engagement. That a donor wants to have confidence in the gift that they're giving, that they don't want to be a man on an island by themselves. And so having the CEO affirm, this is the strategic direction. We share your goals. We share your vision. Not only are you investing your resources, but we're investing as well. And Norton Healthcare and the 2 foundations will have skin in this game. If we are going to build a number 1 program, it's a $60 million vision. It could be a $200 million vision. There's no end to greatness, right?
Yeah.
So, but these gifts don't happen without full clinical engagement from the clinical team and full executive engagement.
Well, so I'm going to switch gears for just a second, because I know that, because we've been friends for so long and we've done so many things together, I know your commitment is similar to mine about health equity. And in particular, I am so pleased to in the leadership that Norton's taken about building a brand new hospital in the West End. Talk to me about that as it relates to philanthropy, but also kind of as a strategic initiative for the organization.
Well, I think that, every year we do a community health needs assessment, and every year we get the data back. And
so you do that every year?
Every year.
Okay, because these are some of the things that I think that for those that aren't you know, for a lot of times when I talk to students, they don't understand the groundwork that goes in to understanding what's really going on, so that it's not just, I think this is a good idea. You know, having that assessment gives you an idea about what's really going on.
Right.
And then you can apply the things that you already know to that. So it's I always call it data informed, not necessarily data directed, because I think that there's a mix between having data, but you know that the people on the street are the people who also have a key data set,
right,
that sometimes are overlooked because they're not on paper.
Well, and I think it's important too to have focus. You could say, like, how do you eat an elephant one bite at a time, right? So Norton has always had outreach to the community. We have a faith and health ministry team. We have health prevention teams. We do a community health needs assessment every year. Much of this work started early in 2004. We rolled the first mobile prevention vehicle into the community. We just added a second mobile unit. So, there were pockets. You could say, well, we know that Jefferson County outpaces Kentucky in the incidence of cancer or heart disease or infant mortality or child abuse. So we had programming that was developing in those areas. And then in 2019, our CEO announced the creation of the Institute for Health Equity and hired Dr. Kelly McCants to be the executive director and to lead that. A lot of the work early with Dr. McCants was around building trust. And why are there barriers to healthcare in Jefferson County, and why are they disproportionate in these 9 neighborhoods of West Louisville? Okay.
Yeah.
Why is it that we're seeing more kids with asthma come to the emergency department out of 402, 10, 11, and 12 than any other zip code? So trying to tackle some of these disease by disease specific things. The Institute was created with 5 imperatives, and from there the work started to grow. We opened Molo Village at 12th and Jefferson as the Institute's headquarters to put a flag in the ground and to say, we're here, we're going to build partnerships with the community, and we're going to look at this. We started funding community health workers. We funded doulas. We had many community partners who stepped up to help with food pantries to really get at those social determinants. And I think it weighed heavy on leadership, and Russ said we have to do more. We announced this, we've created the Institute, we've announced a $20 million investment, but it's not going to be enough. And from there, the vision was born to create the hospital at 28th and Broadway. A lot of big health systems across the country are leaving the inner city and they're building big bed towers. You see some of that even happening in our community. But we're going in with a specialty hospital. We're in the ground, it's underway. Hopefully by summer of 2024, we will be occupying the facility. Emergency department, inpatient beds, operating rooms, lab, diagnostics, subspecialty clinics, both pediatric and adult primary care. I think more than anything, because we realized that 28 block drive might as well be 28 miles, that you could drive from one county to the other, that we had so many issues around access and improving access to the underserved. And so that's what this facility is about, and bringing up a location in the community where people live and work. And this is the long game, right? This is not going to be solved overnight. This is investing today and engaging people along the way so that 10 years from now, we can look back and say health outcomes look different. We've started to move the needle.
Well, and I think you hit on something at the very beginning that is critical, that sometimes is talked about, but it's almost overshadowed, and that's the ability to serve the people that you want to serve. You have to have their trust. And you don't get their trust because you come in telling them what you can do to solve everything that they've ever had a problem with. Which tends to happen even in our best days,
right.
And so really investing yourself in their time and talent and being able to listen to understand instead of just listen to respond.
Well, that's been an interesting process. This announcement brought with it 8 or 9 work teams.
Okay.
And we have a community outreach work team, and we have collected surveys from, I think, nearly 7,000 people from the neighborhoods.
Wow.
Asking them to wave their magic wand about what they'd like to see there. And so as the survey data is collected, again, the data will inform, right? It's not going to dictate, but it's going to inform. And a lot of discussion around behavioral health, a lot of discussion around the need for subspecialty support. And endocrine and cancer and general pediatrics. And so, people might be in the program and they're coming to a Norton facility for chemotherapy or for radiation, but then they're doing their follow-up care and they're having to come all the way back. So there's no reason they can't do their follow-up care right in the community.
So, just thinking about all there is to address in healthcare and health equity and just, a community our size, needless to say, the fact that Louisville and Norton have taken on a lot of the state issues, and been very productive, proactive about reaching out to more rural communities. How do you, from a strategic standpoint, how do you decide what you're going to do?
Well, the Children's Hospital, for example, is the regional children's hospital. So there's never a year that goes by that we don't see a child from all 120 counties.
Wow, okay.
And probably 35 counties in Indiana. So if you look just at children's, in the early 90s, we started telemedicine. And we opened up telemedicine centers to improve access. Bowling Green, Paducah, Owensboro, where we had large populations, strong referral patterns, and families that were having to come to Louisville for service. So turning on those programs in those communities immediately improved access.
Back in the 90s?
In the 90s.
Okay.
In like 1994,
okay.
The first telemed site came up. So I think when you think about that, we are a tertiary provider. The Norton Neuroscience Institute and the Cancer Institute and Norton Children's bring patients from all the counties. So you have to look at where are your large populations and how can you serve patients better. So you go try to get to those big cities where you can put a clinic in or you can open up a shop and start seeing families where they are to eliminate that burden. I think that's the only way to do it because you can't be in every single county.
Right.
So if you have a family maybe you have a family in Owensboro and they need to be seen in a follow-up clinic, you can say, look, we're in Bowling Green, can you come on Tuesday to Bowling Green? And it's a lot easier for that family to get from Owensboro to Bowling Green than to go from Owensboro to Louisville.
What have you seen, what impact did COVID make on your particular area and how that has impacted philanthropy and the strategy of philanthropy in addressing issues related to that?
Well, the pandemic obviously was a setback for everyone, and we all were isolated and we didn't have the ability to communicate and inspire vision and be out with people. About $4 million a year or $5 of our total revenue comes from events, and all those events were basically turned off. They didn't happen. Donor interest changed, and that we had people at home who said, I will do anything to help. What can I do? So we had donors that were funding drive-through testing, pop-up testing sites, pop-up vaccine sites, telemedicine program to reach people in their homes, convalescent plasma research. We had more accruals for research in convalescent plasma than any health system in the world.
Wow. Okay.
And a lot of that was rooted in the work that we had done in the Norton Cancer Institute. So we were able to take that information and translate it immediately. Norton Healthcare operated the COVID 1-800 health line. We had the poison control center that was already set up and developed, so we had a team of toxicologists and nurses who were already on the phone. So we added a phone line and we used that to manage the COVID calls from all over the state. So I think there was a shift from the donor's perspective to start investing in things that they could do immediately to help and make a difference. Caregivers were under stress. We raised over $1 million for food to feed caregivers who couldn't get to, the cafeterias were closed, the gift shops were closed, restaurants were closed. How did they eat in a 12-hour shift? And we were bringing food in, but we had donors who said, I want to feed the people in the vaccine center, or I want to feed people in urgent care. So that was interesting. I think on the clinical side, it really rapidly enhanced telemedicine and our ability to work smarter and to reach families where they were. Obviously, we were doing a ton in electronic medical record and trying to be more consumer-centric around no-wait culture and really using technology to improve the patient experience. And I think the pandemic just elevated that.
From your experiences, is there one thing or two things of advice that you would give to somebody who, so usually in this class, it's kind of a mix of younger, I say there's usually three groups. There's this young group who have been in college, they've done some work, but they've not really done much in their career yet. They've invested in the intellect and the academia side and really want to be prepared when they hit the workforce. Then you got a second group over here who have been in the workforce, see that there's a gap in their opportunity to maybe address some things, or maybe even an opportunity is not open to them because they don't have an MBA or an advanced degree in that knowledge. And then there's a third group that I've found in this class that tends to be physicians. It's funny, I'd say that, of all the careers, the physicians, that I've worked with, in these classes, they've really wanted to learn how to do the business side of the equation. Is there, one or two pieces of advice based off of those groups that you might think about if you're starting a career and you want to understand how to utilize strategy? These are the two or three things that I think that most people don't tell you about that, that are important. Like the thing that I usually talk about is that, that time is your friend. It just feels like it's never enough.
Well, I think that's important. I mean, we came into our careers with a dramatic sense of urgency and a real drive for results, which I still have a strong drive for results. But I think as I've matured in my career, I'm more patient with myself and others. I don't know about a drive for strategy, but I think a couple of things just overarching. The world is hungry for ethical leadership.
Yeah.
And having honesty and integrity in what you do, knowing that your word is your bond, that means everything. And I know I have people here that I can depend on. If they say they're going to do it, I know they follow through and do it. It's not going to a black hole.
Yeah.
So being willing to stand up, to do what's right, to have your voice, and to follow through is huge. Inspiring a sense of vision and not being put down by being told no. I mean, I work in fundraising, right? Yeah. So I'm not a salesperson, I'm a nurse. But I think it's a sales mentality, and that I don't take it personally, and I'm not going to be hurt if you say no.
Yeah.
That it might be no, it might not be no, it's going to be no, not right now.
Right.
Maybe later.
Right.
Just to understand, it's not personal. We all want the same thing. We're all good people. We're all working towards a common goal. And then what piece can you play? How do you fit into the broader picture? You're not just a physician. You're not just a young student. Come in, do the work, show up, and stick with it.
Mm-hmm.
I've been here almost 19 years. I cannot think of any, maybe two or three in this entire city that have that much longevity, that have actually stayed around to be part of it.
Yeah.
And I think in nonprofit leadership, it's a very high turnover.
Yeah.
Every 3 years, and it almost takes you a year to come in and figure it out.
Yeah, for sure.
And so being willing to stay with it, and to know that sometimes you're just doing something for the long view, like the development of this hospital. That's for the long view, to change outcomes, to build trust, to improve services, to extend the reach. That many of the things that we do, we may not be the beneficiaries of, but it's going to be the generation that comes behind.
Well, I do know, because of our history, you were very successful at the Center for Women and Families. You had gotten to a point where the center was nationally recognized. What really brought you to Norton? Was there one or two things that, made you make that move? Because, that balance of saying longevity, but then understanding that sometimes you have to make that move.
Well, I had a conversation with leadership at Norton. They had zero philanthropy. They were raising maybe $2 million a year. They had not had real leadership. I think their boards were underdeveloped. And I came in on the children's side, but there were a couple of things about children's that were unique for me, that were similar in a way to Center for Women and Families. Norton Children's Hospital is a unique asset for the region.
Yep.
It is an important and unique asset for the region, just like Center for Women and Families. And Norton Children's Hospital was an underappreciated asset, and that people didn't recognize its value and did not support it. And for me, it was those two things about children's that were exactly true at the center when I went there. And I guess the third, sort of the icing on the cake, was the fact that I am a nurse by training and I started my career there. So I understood it and I knew it. And honestly, I think being a nurse has made all the difference because I can come at it from a different perspective. I've been there. I know a lot of the clinical team that I worked with when I started as a young nurse at Children's. Many of them are still there. So it's been a compelling mission that I embrace, that I care about in my own personal life, and I feel I can carry the flag for.
Well, and I've said this many times out in public, and I'm going to say it here, is that, I would not have gotten into healthcare had it not been for you. Because as you may not remember, I hadn't literally visited a hospital since my dad died, which was, I don't know, he died when I was 13. And when you came here to Norton and then you invited me to come, I hadn't stepped in a hospital because it was a trauma event for me. And so if it had not been the relationship that I had with you, I'd have never gotten into healthcare. And I think that gets back to that second point of, ethical leadership and being able to trust somebody. And so often I think that when you're grabbing for some, transformational greatness, something that you're doing to try to help change something that has been plaguing people for a long time, it takes real trust, a deep level of trust that only comes about when you have more than just a professional relationship. They know that who you are, not just what you do.
I mean, for me, that's the story of Norton Healthcare, right? That we are an organization that's been in this community for more than 130 years, founded by the Reverend John Norton, who was the Good Samaritan and was beloved by so many people in this community. A local organization run by local people who live here and work here and their families come for care, and governed by a board of directors that's local, that lives here, that are all volunteer servant leaders who give their time and their talent to be part of making Norton Healthcare what it is. And so that level of trust, I think you're right when you say that. You can't match that.
No.
And we can leave, and that level of trust and that mission and that commitment is still there.
Yeah. Well, and I think that that's a beautiful thing about Louisville, is that there are so many people who have, been born and raised here. You don't have to, but you find your home here. And people, when it's their home and not just a place that is a transitional stop for them, then you're willing to, go through those kind of battles. Because let's be honest, whenever we do change the way that we're trying to change our culture and our community, it's sometimes more of an uphill battle than we think it should be, but it's well worth it in the end. I think about all the change that you've made here, and obviously with the help of leadership and everything, but in particular with this team, and knowing that you're doing so much with the place that you've been presented an opportunity to do. And you don't have to be the neurosurgeon who's saving, in the surgery center. You can be the person who's out there bringing the dollars that have brought that person the technology, the workforce, the capital, the knowledge, all of those things. And yet without you, there would be no saving, and I think that that's the thing that I recognize as I get a little bit older and I understand the importance of how things are interrelated. And, if we all just do our part and we do it as well as we can with this high level of integrity as we can, it usually makes the pieces bigger.
Well, and I think too, for young people in the class, especially as you think about how you come in and out of relationships, I have a little quote on my refrigerator at home that talks about how you leave the room. To leave the room and close the door gently, and to leave the room with grace, and all of these things as you enter and exit. Right when you leave a business, some young people will say, I'm out of there, and they walk out. But as you said, we're a small town, and so much is relationship driven and really tied to integrity. And I think always keeping your head held high, leaving the room with grace, leaving the job with grace, giving proper notice, doing the work to the best of your ability before you make the final exit. You never know how those relationships might come back. And I think about early in my career, places I worked where those people are now on my board, or being at the center and bringing you, or bringing a board member, or bringing that all of this over the course of a 30 or 40-year career can be interconnected.
Yeah.
And so the way that you carry yourself and the way that you live with integrity, like I want to be a person who lives with integrity in my life. And I don't want to have any shortcuts because I don't want to feel bad.
Yeah.
Right? I don't want to have that hanging on me.
Yeah.
So I'd rather just do it right and live my life with integrity to the best of my ability.
Well, I think that's a great way to end. Thank you so much, Lynnie, for making time for this interview. And appreciate it. I'm sure that the class is going to get a different perspective than they've ever thought about in healthcare through philanthropy. And so thanks for your time today.
Enjoyed it. Thank you.